Welcome to Dr. Mai, sharing medical knowledge. In this article, we'll explore vagus nerve stimulation, VNS, an innovative neuromodulation therapy that treats epilepsy, depression, and aids in stroke rehabilitation. Don't forget to subscribe to the channel, like, and comment below on the topics you're interested in to help support the channel and unlock more engaging content. What is vagus nerve stimulation? Vagus nerve stimulation is a type of neuromodulation therapy, meaning it modifies the way nerves function by sending mild electrical pulses through the vagus nerve, located in the neck. The implanted device sends pulses from your neck to your brainstem, where the signals are distributed to various parts of the brain to adjust cellular activities. Often called the pacemaker for the brain, vagus nerve stimulation is considered a treatment option for individuals with conditions that are unresponsive to conventional therapies. It has shown promise in managing treatment-resistant epilepsy, major depressive disorder, and improving motor function as a rehabilitation aid after a stroke. The role of the vagus nerve, cranial nerve X, is one of the 12 cranial nerves that act as communication channels between your brain, heart, lungs, and abdomen. Running from your brainstem down the neck and through the chest and abdomen, the vagus nerve plays an essential role in regulating involuntary body functions like heart rate, digestion, and respiratory patterns. Because it links key organs in the brain, stimulating the vagus nerve can affect numerous physiological systems, which explains why vagus nerve stimulation is being explored beyond epilepsy and depression for treating chronic inflammatory diseases, migraines, and even Alzheimer's disease. FDA-approved uses of vagus nerve stimulation. The U.S. Food and Drug Administration, FDA, has approved vagus nerve stimulation therapy for several conditions. 1. Epilepsy treatment. Vagus nerve stimulation is approved as adjunctive therapy for focal seizures in individuals aged 4 years and older when medications fail to control seizures. Research shows that 43% of patients experience a 50% or greater reduction in seizures after 1-2 years of vagus nerve stimulation therapy. 2. Treatment-resistant depression. For adults aged 18 or older with recurrent major depression that hasn't responded to 4 or more antidepressants, vagus nerve stimulation offers new hope. Studies show 20–30% of patients report improved mood after a year of vagus nerve stimulation therapy, though it's not always effective for everyone. 3. Stroke rehabilitation aid. Vagus nerve stimulation is used to enhance motor recovery in patients with moderate to severe arm and hand mobility loss due to an ischemic stroke. Clinical trials reveal that vagus nerve stimulation combined with rehabilitation exercises led to 47% of patients achieving significant mobility improvements. Although the exact mechanism isn't fully understood, vagus nerve stimulation appears to work differently depending on the condition. Epilepsy. Vagus nerve stimulation helps regulate electrical patterns in the brain, reducing seizure activity. It also boosts neurotransmitters like norepinephrine and serotonin, which influence seizure control. Depression. Vagus nerve stimulation is believed to modulate brain circuits involved in mood regulation by altering neurotransmitter levels. Stroke recovery. Stimulating the vagus nerve during physical therapy seems to activate brain areas that control motor function, enhancing recovery. The vagus nerve stimulation implantation procedure. Vagus nerve stimulation implantation is a minimally invasive surgery performed under general or local anesthesia. The procedure usually lasts 45–90 minutes and involves 2 small incisions. 1. Neck incision. The surgeon wraps electrodes around the vagus nerve. 2. Chest incision. The pulse generator is implanted under the left chest muscle. Once implanted, the generator delivers electrical pulses to the vagus nerve, following a programmed on-off cycle. A handheld magnet allows patients to activate or deactivate the device when needed. What to expect after surgery. Recovery process. You can resume daily activities within 48 hours of surgery. Stitches are self-absorbing and do not need to be removed. Device programming and adjustment. At your first post-op visit, your healthcare provider will turn on the stimulator and gradually adjust the settings to find the right balance between effectiveness and comfort. The device has an on-off cycle, battery life and maintenance. The device battery typically lasts 5–10 years but may need replacement earlier, depending on usage. Battery replacement involves a brief outpatient procedure. Potential side effects and risks. Common side effects: hoarseness or changes in voice, coughing or throat tickling, mild neck pain or headache, shortness of breath or difficulty swallowing. Serious risks: infection at the incision site, vocal cord paralysis or Horner's syndrome, heart arrhythmias or, rarely, cardiac arrest. If any of these symptoms occur, your healthcare provider can adjust the device settings to reduce discomfort. Serious side effects may require temporarily turning off or removing the device. Who should avoid vagus nerve stimulation? You may not be a good candidate for vagus nerve stimulation if you have breathing disorders like COPD or sleep apnea, a history of schizophrenia or bipolar disorder, heart abnormalities or arrhythmias, pregnancy or conditions requiring frequent MRI scans. Beyond the approved uses, future research in vagus nerve stimulation. Researchers are exploring additional uses of vagus nerve stimulation, including migraine management, fibromyalgia pain control, inflammatory disorders, diabetes management, Alzheimer's disease treatment. While still experimental, these studies suggest that vagus nerve stimulation might hold potential for many other chronic conditions. What should you discuss with your healthcare provider? If you're considering vagus nerve stimulation, ask your healthcare provider about insurance coverage. Not all vagus nerve stimulation procedures are fully covered by insurance. MRI compatibility. Some vagus nerve stimulation devices are affected by magnetic fields. Long-term outcomes. Vagus nerve stimulation may take months to years to show its full effects. Alternatives. Discuss other treatment options before making a final decision. Is vagus nerve stimulation right for you? Vagus nerve stimulation is a promising therapy for those struggling with epilepsy, depression, or limited motor function after a stroke. While it isn't a cure, it offers hope for improved symptom control and quality of life when traditional treatments fail. If you or a loved one is considering vagus nerve stimulation, speak with your healthcare provider about the risks, benefits, and long-term expectations. Thank you for watching. If you found this article helpful, subscribe to the channel, like this post, and leave a comment about topics you'd like to see covered next. Your support helps us continue to share medical knowledge and explore fascinating health topics. Stay tuned to Dr. Mai sharing medical knowledge for more insights into advanced treatments, wellness tips, and healthcare breakthroughs.